Good morning. My name is Trisha Isaman. I'm the Senior Director of Housing Programs at the Housing Council at PathStone. Here with me today is Giselle Fonseca from the Housing Council, who will be monitoring the chat for questions. I'd like to welcome you all and thank you for your interest in today's topic. The Housing Council at PathStone is celebrating 50 years of critical housing services to the community, and this discussion is one of a series of conversations with the community about important housing issues impacting the Rochester area. Our mission at the Housing Council is to increase success for low to moderate individuals and families in Monroe County and surrounding counties to navigate the steps to a successful tenancy and homeownership. So what the Housing Council at PathStone offers and who is served by the Housing Council? The Housing Council at PathStone serves over 8,000 households annually, provides housing counseling and intervention services for tenants and homeowners, offers comprehensive assistance and direct training to landlords, maintains a housing hotline, promotes fair housing awareness, and publishes a rental registry, which is distributed throughout the community. In addition to the panel discussions, the Housing Council will be hosting a 50th anniversary celebration on October 6th. We'll provide more details at the end of today's panel, but we hope that you can join us. Now on to today's topic. Investment in your home is an investment in your health. Before we get started, I want to introduce our panelists. Katrina Korfmacher, Director, Community Engagement Corps, Environmental Health Sciences Center Professor of Environmental Medicine at the University of Rochester Medical Center. Welcome, Katrina.
I've worked with the Housing Council for most of my 20 years here in Rochester, and on such a wide range of projects, it would take an entire hour to talk about just those. So I'm just going to give a quick introduction to who I am and how I come to work on housing as a professor of environmental medicine. So really thrilled to be here with the other guests, and sort of surprised because I was trained in ecosystem management. I'm a policy scientist, and what I studied in graduate school was how to get different agencies to work together to protect the national environment. But when I moved here to Rochester, I discovered that the biggest problem facing this community was childhood lead poisoning. And I refused to believe that at first, because lead poisoning had been dealt with in every other city I'd been in. There was a 95% decline in lead poisoning already by 2000 when I moved here. But when I looked at Rochester and learned that our rates of childhood lead poisoning were still 20 times the national average, I realized that was a problem that really needed attention. So I tried to figure out how I could help with that, and discovered that there was this coalition to prevent lead poisoning, and joined that as it was getting started around 2001. And lots of groups throughout our community participated in that effort over the last 20 years. And as you all know, succeeded in passing what's now considered a gold standard local lead law in 2005. And that's resulted in lead poisoning rates in our community coming down nearly 2.5 times faster than anywhere else in upstate New York. So that's a pretty huge success if you look at it there. But I realized when I started going into houses and talking to community members that lead is just the tip of the iceberg. That really matters for children's health. But when you get into a house and you see that there are also leaks that lead to mold hazards that contribute to asthma, or insecurities that threaten safety, or pests that are also contributing to asthma and other health issues, you realize that the home is a holistic system, and you need to deal with all of that. And not only that, but it's not the physical structure, but also the residents and the relationship between those two. So going from child health to whole family health in terms of healthy homes was a direction that I took after the lead law was passed. And then further realizing from working with the Housing Council and others that the home is also essential to the whole family's well-being, economic, safety, and stress-wise. So things like energy efficiency and structural soundness are also really important. And then if you look even more broadly, you realize it's not just the one house, but the houses around it and the whole neighborhood that contribute to a family's ability to live a successful, healthy life. So at the community level, thinking of housing as a part of neighborhood well-being is really important. So recently, as I've been thinking more and more broadly about Rochester's redevelopment and its success in the future overall, been taken with this framework of 4 pathways connecting housing and health. And I'm going to put the citation for this article because I'm an academic geek. I have to cite an article here. And its 4 pathways are stability, safety and quality, affordability, and neighborhoods, and tracing how housing connects to health through all of those different ways. So I will put that in the chat for you, and hopefully that will provoke some discussion later on. Thank you.
Thank you, Katrina. Next, we have Chris Raymond, Deputy for Housing Rehab Programs at PathStone. Welcome, Chris.
Good morning. I'd like to say what she said. You know, she said a lot, but I've lived in Rochester my whole life. So, and I've worked in construction my whole life. So I've got 25 years of experience in the field doing pretty much every phase of construction, and then 15 years of experience in the office. So I'm like a carpenter that's pretty good at accounting. But what we do, so I'm old enough to see from like when I first started, you know, it was always, this is how we always did it. This is how we always did it. And that's how you always did it. And then slowly how to work with lead paint trickled in, you know, how to work safely with lead paint. Everybody worked with it before, but then they had to learn to work safely and take training. And then BPI came around and we learned why we do what we do with insulation and how to insulate properly, how to make homes breathe properly. So it's pretty cool. I've seen it from when construction is really just swinging a hammer to learning why you're doing what you're doing. And then what we do on our end is we're really a liaison between the state funding agencies and the homeowner living over on Hudson Ave, Joseph Ave, or out on Gravel Road, Medina. So we're really like a liaison between the lower income homeowner and the state. So we get the money from the state and get it to the lower income homeowner.
Great, thanks, Chris. Lastly, we have Elizabeth McDade, Renew Program Director. Welcome, Elizabeth.
Good morning, everybody. So I've had the privilege of working with Katrina for well over 10 years at this point, and with Chris for almost that long, but not quite. And so we've really been looking at the realms of how does health and housing interact? How do they impact each other? How do they connect? What are the policies and procedures that you can put in place to actually make sure people are living in healthy and safe homes? I am the director of a program that is an initiative that is housed at the Rochester Area Community Foundation that helps fund projects that would otherwise not be funded, that help low to moderate income homeowners make their homes more energy efficient, healthier, and safer. I've also worked with the Coalition to Prevent Lead Poisoning, and I've been able to work with the Housing Council for many years on doing education and outreach in terms of keeping everybody safe from lead hazards. And, you know, Katrina really did underscore the importance of, and really the reputation that Rochester has, this idea of really being at the forefront of thinking about how do we allocate our limited resources, how do we bring best practices to the table to inform the process, to really, and how do we keep monitoring and evaluating the processes to make sure that they are being efficient, that they're working well, that the people that are actually implementing the work can do the work. And what, most importantly, in part of all this, evaluating the data afterwards to make sure that the policies and procedures that we've put in place or the programs that we're working with are actually doing the job that we envision them doing. And if not, then how do we fix that? And so I actually think that's been one of the hallmarks, this idea of sort of sitting around the table and talking about, you know, bringing you know, great minds to the table, the brain trust to the table to really sit around and talk about what things look like. It's sometimes hard to visualize how important that is, but it really has made us a huge difference. And so through Renew, we are bringing the Rochester Healthy Home Partnership practices, the Coalition to Prevent Lead Poisoning practices, and we're working with community partners, as I said, to help braid all of our resources to help low to moderate income homeowners make their homes more energy efficient, primarily healthier and safer. We've now helped over 300 homeowners within Monroe County, actually closer to 340. And we've put collectively, and by collectively I mean through PathStone, through all of our community partners, over $5 million into our community to make homes for low to moderate income homeowners more energy efficient, healthier, and safer. So it's great to be here with these two of my colleagues, in particular, Chris and Katrina, who I value and work with every single day primarily. And thanks so much, you guys, for inviting us to have this conversation.
Thanks so much, Elizabeth. So now on to the panel discussion. The panelists will be asked a series of questions. If at any time the audience has a question, please enter your question into the chat box and we will address the questions at the end of the panel discussion. So the first question, a group question. Can you speak on the overall impacts of housing on physical and mental health? Chris, we'll start with you and then we'll get additional feedback from Katrina and Elizabeth.
There's a lot of things here, but I'll go with mental health because to me, the physical is just so apparent to me because that's what I see. But the mental health we really see when we're done and the folks are so happy with the work. Meaning I from when we just wrapped up. We visited a homeowner at the conclusion of his job, and Elizabeth asked him, like, what's the biggest difference? And the gentleman goes, I have company. His bathroom was so bad, it was totally black with mold, the ceilings were falling down, and our job was a new roof and a new bathroom, ventilation, heating. And this gentleman, for probably looking at the condition of his bathroom 5 or 6 years, never had any company because he was too embarrassed to have folks over to the home because he didn't want them using the bathroom. It was just that atrocious. Another one we did, we ran a program with fixing mobile homes, and we're running one now. And at the conclusion, I asked, well, what's the biggest difference in your new home? And I thought, going from a home that's falling down to a brand new home would be the difference. And his biggest difference is he had time to go fishing. He didn't have to work on something being broken every day. So the mental aspect of having a healthy, safe home in good repair, that's what I like the most about what we do.
Great. Katrina or Elizabeth, do you have anything else to add of the overall impacts of housing on physical and mental health?
I totally do, but I'll just wait to see if Katrina has something.
Well, I started with lead always because, here's the thing about lead. It's gotten a lot better. It's still a big problem, but it is the key in the door. And partly because it's the one thing that you can connect the house, to the lead dust on the floor, to the lead in the kids' brain and blood, to the effects on their brain and their bodies for their entire lifetime. Now, that's special for that reason, because it's the one thing that you can count so clearly, but it's the tip of the iceberg. So in a place like Rochester, housing is probably responsible for upwards of 90–95% of childhood lead poisoning. In other places, it might be a smaller percentage, like Flint, Michigan, right? Where for a while, water was a significant contributor. But there's also asthma, and asthma is a huge problem for a larger group of kids. And the best estimates are that housing contributes about 30% of asthma exacerbations, which is also massive if you think of the effects on kids' ability to go to school, their parents' ability to go to work, and other respiratory conditions. So the same triggers that give kids asthma attacks make it harder for people with COPD and other respiratory complications to breathe. We don't know that because it's hard to study, but it just makes sense that it also has a huge effect. Another area that's well documented is trips, falls, and unintentional and injuries. We know that the majority of those for kids take place in the home. And then, of course, there are things like fire and other really devastating things that are relatively infrequent, but can lead, and carbon monoxide poisoning that can lead to really severe illness or death. But I think that I like where Chris started. It's really all of those things taken together with the overall impact on a family's physical and mental well-being that you may not see right away, and you may not be able to count or connect in this moment between a housing hazard and health. Those long-term, lifelong effects, the cumulative effects, the effects on mental health and the whole family's whole lifestyle probably dwarf the things that we can count like lead. We just start there because that's what we can count.
And I would just say, especially in this past year when we've been told to stay at home, right? That's assuming that our homes are safe and healthy places to stay. And I'm assuming after a difficult day, we all go home, we close the door, we exhale, right? We're home, we're safe. And if your home has a leak, for example, that is possibly causing damage to your electrical system, that could possibly cause a fire, or if you have some type of issue with a respiratory condition, like one of the homeowners that we had that had mold in the basement and she could not pay to remediate that herself. We ended up, she had a respiratory condition that was part of the COPD family. We ended up getting her connected, and she also took care of her grandchildren. We ended up getting her connected to a City of Rochester lead grant. She got some funding through NYSERDA through PathStone to do some energy efficiency work. And we also remediated the mold. She got a new hot water heater and she got a new dehumidifier. So later on, when I was talking to her, not only had her physical symptoms diminished, she was, and this is going back to Chris, she was most happy that she had a new hot water heater and she did not have to choose between taking a shower and washing her clothes. And these seem like small things, but, and this is also going back to what Chris and I have learned with talking to a lot of our clients, that it really is about sometimes very small changes that make enormous levels in the overall quality of life. We had one homeowner who shared that he had depression, but when he saw the work that was being done in the home by all of the workers, it actually made him, it lightened his load. And it also made him, compelled him to do additional work that was outside the work scope. It wasn't, I mean, because this work isn't, you know, homeowners don't get to make a list of all the things they want to get done, right? There's a prioritization of the work that gets done, and not everything, you know, that a homeowner might want to have happen happens. But this guy ended up going out and doing all those extra things, like painting the side door to match the rest of the house and so forth, because he was really taking pride in the home. He was really feeling empowered, and he was feeling motivated and feeling better about the whole situation. Those are just, you know, a couple of examples, and we could literally go on, but making sure that you've got a healthy, safe place that is not making you sick by having mold intrusion or by some of the issues that we see with badly insulated homes, for example, is that you're also paying extra for your heating bills, and that's also a stressor. You know, cold and inconsistent temperatures can, as Katrina said, can add to asthma triggers, can add to any of the respiratory conditions that we're talking about. So really making sure that your home is insulated, so we're not, you know, we're also not contributing to greenhouse gas emissions. We're reducing our energy costs, all of those things. We're seeing reduced healthcare costs. All of those things can be tied into making sure your home is as healthy and safe as possible.
Great points. Katrina, can you speak to what is the Rock Home study and how do you think it could help?
Oh, thank you for asking about that. That is my current pet project. And it is a research study that we're doing in partnership with the city of Rochester. I was just telling a friend about this recently that I do a lot of research, but I'm not a researcher. I first look at community problems and try to solve them and learn as much as I can from the process. So although this is a research study, it's been informed by talking with the Rochester Healthy Home Partnership and other community groups for over 10 years about how important it is to engage residents in when you're doing home rehabilitation so that they know how to maintain a healthy home once, you know, Chris's team makes it safe. For example, if you install bathroom fans, people need to know to use them and how to use them. If you seal up a kitchen, you still need to learn, you still need to know how to keep food in containers so pests don't come in. So we're partnering with the city of Rochester's HUD grant program to look at whether involving the residents of the owner-occupied houses that they give housing grants to helps to maintain a healthy house going forward into the future. And we hope that that could inform HUD and other grant programs to put more emphasis on the human side of making sure that people live in homes, know how to maintain them safely, and live in them in a healthy way going forward, because it really is, as I said before, a partnership between the house and the family living there.
Makes a lot of sense. This is a group question. What might make the biggest difference in improving housing and health in our community? Elizabeth, I will start with you.
I think we need to be insulating all of our beautiful 1920s era housing stock. I think we need to make sure we're looking at rental properties in particular, because tenants in some cases shoulder a disproportionate burden for energy costs. And I think we need to install as many clean heating and cooling technologies, so things like heat pump furnaces and heat pump hot water heaters that are not using fossil fuels to work and are more efficient are also things we need to work on. I think one of the things that that we're lucky in this community is that we already have an infrastructure for doing this type of work. We're just limited by our funds. And so, of course, I've been talking about, you know, trying to get American Rescue Plan dollars to come to this community and really look at how do we make all of our homes energy efficient. You know, how do we make sure that we are reducing our fuel costs, reducing our greenhouse gas footprint? You know, even things like making sure we're putting high albedo roofs when we're replacing our roofs on there, so we're reducing the heat island effects. All these things that can contribute to reducing our impact on the climate and making our homes healthier and safer are not that hard to do, quite honestly. And we certainly have the know-how and the expertise in this community to do it. So that is not a small thing, but totally doable.
Mm-hmm. Chris, do you have additional feedback about the biggest difference in improving housing and health in our community?
I do, and I'm going right back to the people aspect of the home. I guess I spent so long doing the physical work on the home that the people part of it is really what I like. We do a lot of work for low-income seniors, and a lot of it is roofs and the exterior of the building, aesthetics and accessibility. And I really like that the folks can enjoy the home while they're still there and live out their golden years in a safe home. And I think the biggest thing that people who have more means take for granted is the generational wealth created by home. And I can really see it when I'm working in certain locations like the 19th Ward in the 70s and 80s. You could get a house for 20 grand, you know, and folks living there, they got their home, they raise their kids there. Now, when we just wrapped up, she's in her 80s and her house is worth 180,000. So, you know, her and her husband struggling to hold on to that house. They'll cover college for a couple of grandkids when she passes, or if this house will probably go to her granddaughter, you know. So I really like more the preserving. I added preserving to your question because I really like preserving a home for the next generation to come in. Katrina?
Sure. Well, if I were to answer that question outside of Rochester, I'd say two things. One is do what Rochester does. Inspect every rental house for quality, because that clearly works. And I think that for those of us who live and work in Rochester, we don't realize how unusual that is. So the Coalition to Prevent Lead Poisoning has worked closely with Buffalo and Syracuse, which have passed their own law, but they have the huge problem because they don't inspect rental housing. They don't even know where the vast majority of their rental housing is. So trying to deal with a problem like lead or asthma triggers is much, much bigger there because they don't even reliably and consistently inspect rental housing. So I think doing that everywhere that it's feasible in an affordable and sort of phased in way would be the first one. And then the second, for particularly to make sure that owner occupied homes are also covered, inspecting homes for lead when they're sold, because that's something that we intended to do, we meaning the federal government, in 1998 with Title 10, and that's never happened. And because of that, generations of kids have been lead poisoned just because their families don't know that there's lead in their houses. And if we simply inspected each house that was built before 1978 once when it was turned over, then every family would have that knowledge. So those are my outside of city of Rochester, but for within Rochester, and to have three things. The first is to directly engage health systems in improving home health in many places, and it's allowed to be paid for under Medicaid. You can write a prescription for a home assessment and have health insurance pay for certain rehabilitation efforts. That takes a lot of work to figure out logistically and administratively, but it's a powerful tool that we haven't implemented. The second one is to reward landlords for providing healthy housing. Our housing allowance has not been increased since 1987. And it's very, as you all know, very, very difficult to maintain rental housing in Rochester in livable condition on that amount of housing allowance. And on the flip side of that, allowing, providing a rental subsidy or increment for a higher standard of care. So having a higher level of inspection and rewarding that with a higher rental rate for subsidized housing and public support. And then the last one is helping low-income owner occupants. You know, that's a big and underappreciated feature of our housing market, I think, compared to many others, and so important to preserving families' wealth, particularly in under-resourced community. And that means three things: replacing roofs, replacing windows, and replacing siding, probably in that order. Thanks.
Great, good points. So Elizabeth, I know we have spoken, we've touched on lead some, but can you go into a little further of what are some of the long-term effects of lead paint on health?
Yes, so lead paint is a neurotoxin. Well, lead is a neurotoxin, and it was an additive that was put in paint well over a century ago, and it was actually added to paint to help it make be applied easier. But it's also a neurotoxin, and it's an element, and it's something that is poison to anything with a nervous system. So that includes all humans and animals, and anything that, as I said, it actually impacts the way children's brains develop. And it has long-term health impacts on adults that can include things like hypertension or high blood pressure, kidney damage, sexual dysfunction. They are looking at a study that actually correlates lead poisoning early on in life with dementia later on. They're looking at if there's a correlation with that. So not to gloss over any of this, and I'm doing a very, very, very smushed together presentation on this, but it's important to understand that even though we removed lead from paint and from gasoline in 1978, which feels like a million years ago, it didn't go away. And certainly with our beautiful housing stock in this community, all these homes were painted well before 1978. And so the issue is not so much with peeling paint, it's from dust from friction surfaces, mostly on windows and porches and floors. And so you need to make sure the home is being maintained, but the important thing is to understand that even though this thing feels like it's invisible and we took care of it a long time ago, we haven't, and we need to be proactive about it. And the impacts of lead can impact everybody. So from infants primarily, and that's the struggle actually with young children, it actually impacts the way the brain develops. So you come about permanent brain damage, to adults who are working in the industry and are, scraping paint and so forth. Anybody can be affected by the neurotoxin that is in paint. But the good thing is that this community actually has learned how to address it, and we've learned how to identify it, and we have resources to be able to do so. So to not do it the right way is actually really counterproductive and counterintuitive, considering all of the resources that we have in this community to make sure we are doing it correctly, because we don't want anybody else to get sick. We certainly don't want children, and we certainly don't want adults to get sick. And you can very easily, and lifelong lasting impacts that are completely avoidable.
Can you
How's that for a happy morning conversation?
I know. Can you speak a little more on if someone is living in a home that has lead paint, what is the best way for them to maintain the home so they're preventing lead poisoning to themselves or their children?
Well, I hope Katrina and Chris will chime in. So there's two things. We have two homes here in this community. So we have rental property, which is covered by the C of O, certificate of occupancy process. And we also have owner-occupied homes. Owner-occupied homes are not covered by the certificate of occupancy process. So anybody living in as an owner-occupied is free to do whatever they want in their own home. But if we're talking about a home that was built in the 1920s, we want people to assume, if you don't know, we want people to assume that there's lead paint in the home and to work accordingly. And so that requires just working differently, working more safely, taking your time, making sure that you're not creating a public health hazard. For example, in the city of Rochester, you are not allowed to power sand, power scrape, or power wash your home, even if you're the owner occupied, because the dust that's being created, right, or the paint chips that are being sent out into the atmosphere are actually considered to be making a public health hazard, and that's against the law here. So we want to make sure that people understand what they can do, and we have had, though that's not currently happening because of COVID, but in the past, and it will be coming back when we can meet comfortably again, are free what's called renovation, repair, and painting classes. That's RRP, and that was held through the county health department. And that's a day-long class, but what it does is it teaches you, as a professional, you need to have this training. As a homeowner, it's just a good idea to learn how to work safely with lead paint. It's not that hard to do. You want to make sure you're working wet. You want to make sure you're containing the space if at all possible. You want to make sure that you are not power scraping, power sanding, or power washing. And you want to make sure you spread plastic out, you capture any chips. You want to make sure there's no children around. You want to make sure there's no pets around. Katrina, what am I missing? And make sure that if you're hiring a contractor to do the work, that they have the certification. It's federal law, and it has been since 2010, that everybody who is working with homes that were built before 1978 has got to be certified in renovation, repair, and painting. It's an EPA federal law. And so you need to ask your contractor, are you RRP certified? And if they say no, you move on, you find another contractor. You know, part of being an educated consumer is knowing what you should be hiring and what you should be looking for. And so we really want to make sure that people understand that it's you know, the amount of dust that the demonstration that we use to make a visualization for the amount of dust that it takes to consider a home lead or a lead hazard is the amount of dust sugar in a sweet and low sugar packet. So if you took a sweet and low sugar packet and you sprinkled it in your kitchen of your, you know, American Foursquare, that amount of dust, if it were lead, your home would be considered a lead hazard and contaminated with lead paint poisoning, and it could potentially poison children, your pets, and yourself. So it really is a very small amount of dust, of lead dust, that can make a significant impact. And, you know, not to belabor sort of the scary part of this, but we have a lot of resources in this community to do it the right way. And so we have actually created a standard for being proactive about addressing this rather than reactive. So, you know, finding a lead poisoned child means we failed. You know, understanding that a home built before 1978 most likely has lead paint in it, and then working, you know, correctly, or working to make sure we're not creating a hazard, it means we're doing the right job. So we want to get that message out.
Great. So speaking on resources, what opportunities and community resources are available for folks to rehab their homes and improve their healthy housing, and also through American Rescue Funds? Katrina, we'll start with you.
I actually think that Elizabeth and Chris are the experts in that, but I would say there are a lot of different resources that can be matched up through grants. But I also want to say that on the horizon, there's the potential for other resources like tax credits. So a tax credit for lead hazard remediation has been proposed both at the state and the federal level several times, and that has not yet come to fruition. There are also infrastructure funds that are being planned for water line replacement, which is an element. But I think when you ask that question, you're probably thinking about primarily about people who might qualify for grant programs, which Elizabeth and Chris are the experts in.
All right, Chris, I'll turn it over to you.
For the deeper rehabs, you know, the big jobs, there's federal and state funding. Most of the not-for-profits have funding to do that. The city has funding to do it. The county does. A lot of it's capacity and the sheer need. So everybody's overworked. Everybody's working at full capacity. The contractors are, the not-for-profits are, the city is, the county is. So the need's there, but there is a wait. But in the interim, what Elizabeth didn't touch on the lead paint is the cleaning. Every project we do a lead-based paint risk assessment on the bigger projects, and we address lead paint, and we'll be in homes that don't even have lead paint in the home, but they have lead dust hazards in the home. So really the biggest thing everybody can do is check the condition of their paint, wet clean their windowsills, and wet clean their solid surfaces in the house. So as opposed to vacuuming your laminate floors, mop them. And definitely every year, at least once a year, clean your windowsills and get rid of the dust on your windowsills. Those are the big things.
So if someone was interested in accessing resources in the community, where would you suggest the best place for them to start?
There's a variety of programs that are out there, and they're offered by a variety of institutions. So it's not quite as streamlined as we'd like it, but you know what? That it is what it is. So Action for Better Community has a weatherization program. NeighborWorks Rochester also has some programs. PathStone has some terrific programs looking at energy efficiency, looking at roof replacement. Action for Better Community does as well. There are the city of Rochester, and I put the link in the grant in the chat, also has home repair grants. Monroe County Department of Health, not currently, but in the past, and they will again, also has lead grants. There's funding out there. Heat Smart Monroe is one of the groups that's actually helping people figure out if they qualify for energy improvements, including heat pump furnaces, heat pump hot water heaters. There's tax credits out there for individuals. There's rebates that are out there for individuals. So we don't have a one-stop to identify all of this. You know, we wish we did. And it's funny, someone was asking, how come we don't? I'm like, well, if it were that easy, we totally would. But it's, you know, it's a struggle sometimes to make sure. And so I want to encourage people to continue to do research and to ask around, to look, and don't just make a phone call, maybe not get the answer you want. It takes a little bit of time sometimes, and there are waiting lists. I'm not going to say, like, you know, we have enormous need in this community. You know, we have a lot of older homes. We have, as Chris is saying, a lot of older people who are, you know, who are aging. We're hoping to age safely in place. So the amount of need certainly outweighs the amount of resources that are available in this community. And so I certainly hope those in power with American Rescue Plan dollars are really looking at, you know, where those dollars can be allocated in this community and how we can actually best help those who need the most help. But there are a lot of resources out there. And I definitely want to encourage people to do things like, you know, start with an energy audit. PathStone offers a free energy audit. You might not be in the position to do everything that needs to be done on that list, but it gives you a list, right? It gives you a place to start and to start thinking about what might be the options in there. You know, start understanding, start thinking about, like, if we start looking at the value that you save from getting your home insulated, right, and getting some of these newer appliances. We've seen some of our clients that have saved hundreds and hundreds of dollars in the first year alone of their energy costs. That's not going to be true for every single homeowner, but it's certainly true for a lot of homeowners. And so understanding that it takes a little bit of research, definitely does, and definitely some patience. But you know, we have now, as you know, the Renew has helped over 300 homeowners, as I said, and I don't even know how many PathStone has helped. It takes time, but there are resources out there, and we want to encourage people to make sure you're looking around and seeing what's out there.
And one of the things is, don't take your first no for the only answer, because you may call PathStone and your project might not be tough enough where you come to the top, because we have over 400 people have applied. Our waiting list is 400 people, and we score every application we receive. And so you may call us and you would score low because we have a high volume of folks who have greater needs, but you may call need and they may have a shorter waiting list. You may call the city, they may have a shorter waiting list. We try, when folks call us, to get them to other people, to other agencies if we know of a program, but don't take that first no. If we put you on a waiting list, call up another neighborhood organization, call up the town, call up the city. Don't take the first no, because it's only no from me, not from anyone else.
And I would also say that so those are primarily grants, but NeighborWorks Rochester, for example, has low interest loans for homeowners, and they're actually a really great mechanism for, you know, if you're unbankable, right? If you're unable to get a home improvement loan through other avenues, NeighborWorks can be a terrific option for that. And in some cases, their loan program clients and have also worked with and have gotten additional grants. So it's not solely on the homeowner to do the loan. It's this whole package of things. And Ibero, I know, also has programs as well. Neighborhood service centers throughout the city also have information. So there's a lot of information out there. It's just, and it is all over the place. And I know, like I said, everybody would just wishes there's one phone call they could make. That's not going to happen. But we do want to encourage people, as Chris said, to keep calling and to keep looking.
Great suggestions. So, group question: what effect do you think COVID had on housing and health? I know we touched on that very briefly in the beginning, but maybe we can elaborate a little more on that. Katrina, I'll start with you.
Sure, that's something I've thought a lot about, as you might imagine. And would you indulge an academic in letting me share my screen for just a moment?
Sure.
So I thought about this so much because I thought, well, if we can explain to people for lead how, again, just seeing what happens with lead poisoning rates is the tip of the iceberg and probably hides much bigger problems, that might help us realize how important it is for us to address it. So for example, people were initially concerned that kids weren't going to the doctors and getting screened for lead. Now, two parts, things about that. First, as Elizabeth says, if we find a kid who's got elevated blood lead, that's a failure, right? So we really want to focus on prevention. And the second is that although the initial estimates were that kids weren't going to their doctors, they weren't getting screened, and that was a huge, huge problem, it largely seems to have been made up since then. So there really hasn't been a huge depression overall in the percent of kids in our area, at least, who are getting screened for lead in their blood. However, there are lots of other things that have definitely changed that are likely to have increased children's risk. And if you think about all of the impacts of COVID, not just so stay-at-home orders, where kids being at home, remote schooling, parents losing jobs, so they moved into more crowded housing with that economic hardship, or we're simply around more, having more people in one home, putting more stress on that home. So maybe having paint and other basic maintenance things degrading more quickly, and then follow-up health visits, certainly, and then overall agency resources being cramped. So we know about the problems of hiring staff in almost every sector, but if you think about community groups, about health departments, about cities that normally would be doing inspections, managing kids with lead, providing education, providing these grant programs, right, to make repairs, inspecting and following up on concerns, and of course the impacts on the landlords and owners who can't get maintenance done, where repairs are more expensive, getting into homes is more difficult, and with the eviction moratorium, the resources that landlords have being even lower. All of those things, they sort of add up in this cascade to result in a very high probability of more lead hazards in housing, increased exposure by kids, leading to more lead poisoning and lifelong impacts. And I'm not sure we'll ever be able to fully capture that, but if you sort of spin out this kind of a web, a spider web, for all the different kinds of home hazards that there are, I think that you can pretty easily imagine a really tremendous impact of COVID.
Great information. Elizabeth or Chris, any additional feedback you'd like to add?
Well, we think that the impacts that COVID has had on housing is going to be something we're going to be looking at for quite some time. Part of this is also, tons of people were doing home repair stuff, maybe not doing it safely, maybe not following RRP. So we're not quite sure what's going on with that. There were certainly delays, with shipping, all of the stuff that was going on. So contractors were having a harder time getting work done because supplies were more expensive and it took longer to get things. So there was that issue that was going on. And I think also, again, going back to this idea that, we're making assumptions that homes were a safe place to stay. And so if somebody was, if there was some type of mold asthma trigger that was in the home before COVID and they weren't spending a ton of time in the home, but then they have been, maybe their health impacts have been exacerbated through all of this, Certainly if the home was not insulated, we've been, we spent more time at home. So I'm assuming people had their heat up higher. And so that's making an impact also on climate and, and on fuel costs. And I will say that, one of the things, if you're talking about people who have reduced income, making the improvements to the home to make it so it costs you less to heat it and to cool it, puts money back in your pocket. So, it's a really a huge cycle of things that are all interconnected. And I think we're going to be studying this stuff for a long time, quite honestly.
I agree. Chris, any additional feedback you have?
The one thing that I noticed during it is like when we were working from home was the difference in people's workspaces. Some of us have home offices. Some of us take the doors off of a folding door closet and stick a desk in there and work out of their closet. Some of them work off their dining room table. Because there's no place else to go. And the other thing we noticed, and I was the victim of this, is just horrible internet at my house. With all the kids homeschooling, I knew it. When those kids turn on their computers, I didn't get internet anymore. You know, that'd be spotty because they're just the lag on my street. It's that bad. So it really showed the difference on the internet. And some homes were designed to live in, and they don't have the extra space. There's just enough space to sleep. So I can't even imagine someone with 4 kids trying to homeschool them without a basement to turn into a classroom or a sunroom to make a classroom. So I really think if this is going to keep cropping up, we were like, you have to consider that, you know, like a home workspace, and definitely the internet's a big thing, especially for rural folks.
I know I already had my turn, but can I offer one more thing here?
Sure.
So I'm going to put this in the chat as well. This is an article that was written by some colleagues of ours at University of Michigan, who've done a lot of work in Detroit, just sort of thinking through these sort of trickle-down effects of COVID as a structural driver of health inequity going forward for a long term. And so again, I said in terms of like lead and Frank hazards in a home, that is the tip of the iceberg. But that's also in terms of timeline, just the beginning. So if you think about the eviction moratorium and how long that's lasted, it is going to end, and there will be a wave of evictions unless we are really, really effective in ways that just seem insurmountable right now. And we know very well that eviction has long-term severe impacts on families' health and financial well-being for a really long time, even after they're rehoused. And the massive scale of that, I think we're going to see for a long time going forward. Meanwhile, our small landlords are really suffering because many of them haven't been getting paid rent. And as a result, we're very likely to see shifts in our rental market. So smaller landlords being less able to survive and being bought out by larger landlords. And if we look at other cities, we know that doesn't have great implications for maintaining rental housing in good condition. It could happen, but examples from other places make it less likely that when we lose those smaller locally based landlords, that's bad for everybody, renters included. Not always the case, but you know, it's turned out to be the case in other cities. And then the last is for homeowners who have been affected, anticipating a wave of foreclosures. And it may not be anything like we saw in 2008 or 2009, but if you know, I know many of us have thought about the impacts of that foreclosure crisis for a long time, but there's a new book called The Sum of Us, which has a great chapter on how that has continued to impact, wiped away gains in family wealth, particularly for communities of color, for a long period of time, and that we don't even recognize what the long-term and widespread impacts that foreclosure crisis has had on families' wealth. So I'm going to put that in the chat as well, and I think that's an important part of the answer to your question.
I just actually want to follow back up on that because we didn't really mention foreclosure prevention, which is of course what a lot of this work is doing. So, you know, when Renew's clients are seeing a 20% minimum reduction in their fuel costs, when they're seeing cash going back into their pockets, when they're seeing, you know, 100% with self-reported respiratory conditions are reporting better physical and mental health outcomes. You know, these are people with an average income of $29,000 a year, right? So these are low-income homeowners with about, our average is about 3 people living in that home, and some homes have many more people, and some people don't, but that's the average. You know, the benefits that come from making your home, you know, more energy efficient, insulation, making sure that you're living in a healthy and safe place, the payoff for that has unlimited ramifications. When you think about that pebble in the stone and the impacts that it has, there's no box in terms of improvements for all of the individuals, for the neighborhood that's going on, for health and wealth building. There's no box that this type of work does not check.
So we are getting close to our end time. I do see that we have at least one question in our chat, so we do need to wrap up the conversation. I do want to just touch on the foreclosure prevention just real briefly, because we do offer foreclosure prevention services here at the Housing Council. There is funding coming down the pipeline through New York State that should be hopefully available. It does have to be approved through the Treasury Department, but it should be available within the next month or two. And there's going to be a very short window for folks to apply. It's about 30 days. In some circumstances, it can be 60 days. So folks that were COVID impacted, they can potentially get access to funds. And here at the Housing Council, we can assist you with accessing those funds. So I do see there's at least one question in the chat. Giselle, can you?
Yes. So I see, how can we specifically target help and resource to the smaller local landlords who live in the community? Those who have a more present stake in creating a livable community.
Katrina?
Well,
Or I can touch on, so here at the Housing Council, you know, we do have some applications that are pending that we're hoping will get approved, that will be able to hopefully assist landlords who were impacted throughout this pandemic to help them get back on track with potentially repairs, maybe some other assistance. So I would just, you know, keep an eye out for that. We would send more information in our newsletter, but I'm not sure if anyone else has any other feedback on.
They don't have what community they're speaking of, but we do a lot of work with the city of Rochester and the Genesee and Orleans County Health Departments. And it's actually easier to get a grant for lead abatement if you're a landlord. If you're a homeowner, most of them require that you have a child under 6 in the house or that visits the home frequently. Most of them have taken the tack that if you own a rental property, eventually children under 6 will live there and you're automatically approved for the lead grant. So that's one thing that we've seen, that is the only place where the landlords might have a leg up is in the lead abatement, because the health departments realize that it's going to be a transient apartment and more folks are going to filter through there. And it's very likely they have children under 6 because new families are often the renters. So definitely contact your county health department, your county rehab department, and also the city of Rochester if you're in the city of Rochester.
I was just going to underscore that if you're in the city at one point, for example, had home repair grants for landlords. They don't right now. There's no funding for that. It got used up. But you should always be checking these resources, because sometimes grants do present themselves, checking back in with the Housing Council, all of these options to see what's out there. And you know, I'm assuming it's an owner-occupied double. Is that why, if that's what the small landlord is talking about? I'm not quite sure if that's the property that you're talking about. But you could also get an energy audit and the same thing, you know, and sort of understand what you need to do there, see if you qualify for any of the grants that are available, and then start planning to see what's available. Again, if you wanted to do home improvement stuff, Heat Smart Monroe is also an option to look at in terms of what tax credits might be available, what incentives and rebates might be available for you as well. But yeah, it is kind of tough for the smaller landlords. So we are definitely trying to support you.
And PathStone actually has a grant right now for energy improvements. If a landlord in Monroe County wants to apply to the Weatherization Program, the state Weatherization Program requires a match from the landlord. And PathStone has a program where we will pick up 80% of the landlord's portion of the energy improvements.
Great. So we do need to wrap things up. I do want to thank every one of our panelists for their time here today. It was great. We appreciate you being with us and sharing your expertise. We really do appreciate it. It was a good conversation. I'd like to also thank our sponsor for today's panel, Bank of Castile. And before we go, I want to share that we're very excited about all our panel discussions and our 50th anniversary celebration on October 6th. So we hope that you can join us for that. You can learn more information on our Facebook page or visit our website to purchase your tickets. We'll also be recording this panel along with all our other panels, and they will be posting it to our YouTube page so you can view it later if you cannot attend. And I want to thank everyone for being here today. And again, thank the panelists. Thanks so much.
Thank you. Thanks for organizing.
Thank you.
Congratulations.
Terrific. Have a great day.